Hi, Keith Murray with Integrity Senior Solutions and ExpertMedicare.com. Thanks again for joining us for this video series about Medicare. In part one, we talked about the parts of Medicare and the plans of Medicare. We're going to talk a little bit more about the plans in this video in depth. Part two, we talked about why you should use an independent agent over going with a captive agent or going directly to the insurance company. But as I said in this part three, we're going to talk about the specific Medicare supplement plans and how they compare to the Medicare Advantage plan, or as some people refer to them, free Medicare. So again, in this video, I will be referring to the Medicare New Handbook, and you can get a copy of the most current version by going to our website. The link is below in the description. It's expertmedicare.com, and under our resources tab, you can click there and download a copy that you can put on your computer or your reader, such as a Kindle, or to your iPad or Android tablet, and refer to it whenever you want to. We always put the most current year there on our website. You can also go to your web browser and do a Google search for Medicare and You and put in the current year, and it'll bring up the most current PDF that you can download to your computer as well. So I wanted to start here on page 100 of the Medicare and You 2016 book. This may be a different page if you're looking at this video and it's not 2016. The book changes every year. But right here on page 100, it says that Medigap policies are standardized. Every policy is identical from company to company. If you get a Plan F from one company, it is going to be identical to the Plan F that every other company out there offers. So you don't have to go with a really expensive plan. This is why it's important to shop the plans. Have an independent agent shop these plans for you, because the coverage is identical from company to company. And then if you look down a little further here on the page, it says, how do I compare Medigap policies? And I want you to see what it says here. Different, and it's bold. They've actually put this in bold for you. Different insurance companies may charge different premiums for the same exact policy. This is exactly what I was talking about just a moment ago. As you shop for a policy, be sure you're comparing the same policy. For example, compare Plan A from one company with Plan A from another company. That's because the plans are identical. So this is the very next page of the book, and page 101. And if you look down here, there's a chart that I'm sure you've seen. If you're turning 65, I know you're getting a lot of mail every day about Medicare plans. This is the chart that shows all the standardized plans. And as we talked about, the companies cannot vary from this. They have to sell these plans exactly as they're listed here on this chart. Every company that sells Medicare supplement insurance must at least offer a Plan A. And you can see here on the chart, Plan A is just minimum coverage. And they also must offer either a Plan C or a Plan F. And if you look, you can see that Plan C and Plan F are nearly identical coverage. So under the Plan A, you can see that it does not cover any skilled nursing care. It does not cover the Part A deductible, which, as we talked about in video 1, in 2016, that deductible is $1,288, and that covers you for 60 days of hospital care. So you could actually pay that deductible several times a year. The Part B deductible is not covered, Part B excess charges. I've been selling Medicare supplement plans for over 20 years, and I have never had anybody sign up for a Plan A. It is available, it is out there, and but the coverage, there's just not a lot of coverage there. The number one selling plan for many years now, and I'll get more into the statistics in the Plan F or Plan G video that's going to be coming up, part 5 of the series. But you can see here the Plan F, the reason it is number one is because every box is filled in. It covers everything. So when you go to the doctor, you go to the hospital, you go to a specialist, Medicare is going to pay their portion, and then the Plan F is going to pick up all the differences there. And that's just as long as it's a Medicare approved procedure. Now, Medicare is not going to pay for cosmetic things. They're not going to pay for cosmetic surgeries. They're also not going to pay for dental work, vision, hearing aids, and things like that. There are other plans that are available to cover those type of things, but your Plan F is going to cover everything that Medicare approves. Every gap is covered with the Plan F. And so that's why most people like to go with that plan. Some people refer to it as the Cadillac plan because it covers everything. So there's the Plan F. You can see it covers your Part A coinsurance, And also down, you can see it covers a Part A deductible. So it's going to cover all your hospital co-payments and deductibles. No matter how many times that $1,288 comes up per year, the Plan F is going to cover it every time. And then also the Part B deductible is covered. The Part B excess charges, this does have the skilled care covered under it. It also has the hospice care, covers the blood, just like Part A does. It also has some foreign travel emergency. If you see down here at the very bottom box, it will actually pay 80% if you're out of the company. Out of the country. The Plan A does not have any of that coverage, but C, D, F, G, M, and N all have out of the country coverage. None of the Medicare Advantage plans are going to have coverage for outside of the United States. That's something very important to remember if you're going to be doing any traveling. Here's the outline of coverage that we showed in video 1, where we were explaining how the different Medicare deductibles and copayments and everything worked. And if you look right in the middle section here next to where it says Plan F pays, it shows you pay. If you look all the way down that column, there are 0 copays for you. The hospital copayment of $1,288, if you see there, Plan F pays that for you. No matter how many times per year that deductible comes up, the Plan F is going to cover it. Day 61 through 90, day 91 and beyond for the 60 lifetime reserve days that we went over in video 1. You don't pay anything for any of those. And then also, I mentioned it very briefly in that video, you have an additional 365 days of coverage under the Plan F and under the Plan G as well. If you look down under skilled nursing facility care, blood, and hospice care, no payments for you. Look under that column where it says you pay. Everything is 0. Now, except for the skilled nursing facility care, which we talked about, once you go beyond day 100, Medicare is not going to approve anything for skilled care. And so if Medicare doesn't approve it and doesn't pay it, your supplement's not going to pay it either. So that's really the only thing here that's not covered. Just wanted to point that out to you. And then under Part B, you have the $166 deductible, which the Plan F pays. And all the way down those columns again there, the Part B excess charges, blood, clinical laboratory services, home health care, all of that's covered at 100%. You have 0 copays. Right there it shows you in black and white in the column. And that's why Plan F is the #1 selling plan out there. If you look back over here on the first page, look down on you pay under Plan F and Plan G, everything's identical. Plan F and Plan G are exactly the same. As a matter of fact, let me pull that other chart back up. You can see here, everything is identical between the F and the G, except the G does not cover the Part B deductible. Plan G is a great value, and like I said, there's an entire video, number 5 in the series, is going to talk about the Plan F and the Plan G and why the G is the best value for your money. And then also, if you look at Plan D and Plan N, those two plans are identical too, except that the Plan N, which is turning to be quite a popular plan, a lot of people like that because it's a very low cost compared to the other plans. But if you look down here at the bottom, it says Plan N pays 100% of the Part B coinsurance, except for a copayment of up to $20 for some office visits and up to a $50 copayment for emergency room visits that don't result in an inpatient admission. So basically what that means is that when you go to the doctor, you're going to have a copayment of up to $20. So if you only go to the doctor once or twice a year, the Plan N may be worth looking at for you. And then if you have to use the emergency room, it's a $50 copay, unless you get admitted. Now, if you go to the emergency room and they put you in the hospital, you don't pay that copayment. So that is basically how those Medicare supplement plans work. And like I said before, it's very important to understand this. It's very important when you're shopping plans. The Plan F is identical from company to company. Whether you go with Aetna, United Healthcare, Blue Cross Blue Shield, any of those big companies out there, all the way to the little companies, their Plan F is identical. Their Plan G is identical from company to company. Does not matter. So it's very important to shop around and find the best price that you can with a solid company. And we're not just going to put you with some little rinky-dink company that's brand new and doesn't have a lot of business on the books who may end up raising their rates next year or the year after. We see that happen a lot. So we do want a good company, and there are lots of them out there with very good prices. So you can give us a call and we can definitely shop around and find you the best deal on that. I wanted to do just a quick screen share here to show you as we get into the Medicare Advantage program and how it works. This is Bing search engine, and I just put in what is Medicare, and if I scroll down here, the little box that pops up to give a description says Medicare Advantage MA is a United States health insurance program of managed health care, preferred provider organization PPO, or health maintenance organization HMO, that serves as a substitute for original Medicare Parts A and B Medicare benefits. So a couple things I wanted to point out here is, first of all, it's managed healthcare such as a PPO or an HMO, and I'm sure you've heard the stories of HMOs over the years. And then the second thing is that it serves as a substitute for original Medicare. A substitute. This is a Medicare replacement program, and you are basically giving up your Medicare to let an insurance company make the decisions and the calls for your care. And so that is not my wording, that's the wording of this search right here. That's very common knowledge out there, is that this is a substitute for Medicare. A lot of the Medicare Advantage programs do offer some extra benefits that you don't get under traditional Medicare or with a Medigap plan. Things such as some dental coverage, limited dental, limited vision coverage. They may offer a gym membership, and most Medicare Advantage plans also offer prescription drugs as part of the plan. And they look very attractive when you look at them, because many of them have zero premium and others have very low premiums. So they look very attractive. But what a lot of agents don't point out, and what a lot of people don't realize when they're just looking through something they get through the mail or a booklet or whatnot, it looks really good with that zero premium or that low premium, but there are co-payments, there are deductibles and whatnot that have to be met on those plans. For instance, if you go into a hospital, one particular plan I looked at for 2016, it was over $430 per night in the hospital for the first 4 nights. Now after that, the plan kicked in and paid all of it, but that's already $1,700 that you have to pay out of pocket just for hospital. That doesn't include the doctor, that doesn't include the emergency room copayment if you had to go to the emergency room first, that doesn't include the ambulance ride if you had to take a ride in the ambulance. All of those things are extra on a Medicare Advantage plan. And I just had a lady who called me in about 4 or 5 weeks ago who was all upset and wanted to get off of her Medicare Advantage plan and go to a Medicare supplement plan, because about a year ago she was diagnosed with cancer. Now, first of all, she cannot make a change this time of year. With a Medicare Advantage program, you must change each year between October 15th and December 7th if you want to make a change. Now, if you're turning 65 or new to Medicare, just enrolled in Part B, you do have an open enrollment period, just like you do with the Medigap plans, where you can go with whatever plan that you want to go with. But the problem is she can't change right now. And so if your doctor leaves the network in March, you're stuck there until January the 1st of the next year. Even though you have the enrollment period of October 15th through December the 7th, that's for coverage to begin on January the 1st. So she called me up because she was all upset. First of all, she was not able to go to the oncologist that she wanted to. And I know the importance of that. If you look at my About Me page, in my About Me video, I talk about my son who, when he was 11 years old, was diagnosed with a rare bone cancer called Ewing sarcoma. And so we were able to go to the best oncologists around here. We were actually had to make a decision on whether we wanted to go to a national cancer center to have his treatments and whatnot done there, and we decided not to, because the local oncologists that we went to were some of the best in the state. And so she was limited by her network. She had to go to an oncologist that she didn't want to go to. But the main problem she was having is that chemotherapy is treated as an outpatient procedure. She goes to the doctor's office, she has the chemotherapy administered, and it's an outpatient procedure, which means that it's a 20% copay. Now, you do have a maximum out of pocket on these Medicare Advantage plans, that the most that you would have to pay out of pocket in a year, and the most that I have seen this year is $6,700, and there's several plans that have that. Some have it a little bit lower, but most of them are $6,700, and that's what her plan is. So last year, she got diagnosed. She started her chemo treatments. By the end of the year, she had already met her maximum out of pocket for the year, $6,700 that she had to pay. And then she realized January 1st, it all reset. So she had to pay $6,700 again this year. $13,400 out of pocket because she went with a Medicare Advantage plan. Had she had a Medicare supplement with original Medicare and not on an HMO, she would not have had to pay for any of that chemotherapy treatment out of pocket. None of it. And so that's why she wanted to change. But the problem is, it's kind of like if your house is on fire, it's a little late to go get fire insurance. And that's kind of what her situation is, because on a Medicare supplement plan, once you're out of your open enrollment period, you do have to go through medical underwriting. You do have to qualify. And so once you get diagnosed with something, it's harder to move to a Medicare supplement, which is where the better coverage is. It's hard to make that move once you've been diagnosed with something. And so she's stuck where she is. Even during the annual enrollment period, she's not going to be able to move to a Medicare supplement because she got diagnosed with cancer. As long as you stay healthy, the Medicare Advantage program looks great. It can save you a lot of money if nothing happens. But we don't buy insurance for the now most of the time. We buy it for what might come down the road. And I'm not somebody that uses fear. I don't believe in fear. I think fear makes you make some bad decisions. But it is a fact that things happen, and we need to have the best coverage available for when those times come. And so that's what the situation is for her. She's stuck. She can't move. If she could go back and do it again, she would have gone with the Medicare supplement plan. Your Medicare Advantage plan is not guaranteed to renew either. It can go away. Your insurance company could just decide not to offer the plan anymore. They could pull out of your area, pull out of your state, and that happens a lot. Just a couple of years ago, there was a big article about one of the major Medicare Advantage plans down in Florida that dropped 3,000 doctors out of their network right before the annual enrollment period rolled around. And so your doctor could leave the network. Your insurance company could pull out. With a Medicare supplement plan, your plan is guaranteed renewable. Even if the company were to go belly up, which has happened, your coverage would still stay in effect. The insurance commissioner of your state could step in, and or the state where the insurance company is could step in and pull that company into what they call receivership, which is kind of like bankruptcy for insurance companies, is about a simple way you could put that. But they bring them into receivership to make sure that all the claims and everything get paid. And so even if something like that happened, your Medicare supplement is guaranteed renewable. They can't drop it just because you get sick. They can't raise your rates unless they raise the rates for everybody in the state. But with the Medicare Advantage plans, those can come and go. They can leave at any time. And this is a big decision to make, going and finding a Medicare plan to go on, and it's not one that you want to have to do over and over again. This is something you want to do one time, let it be done. Now, of course, as an independent agent, I will continue to look every year, and if we see that there's something better for you to go to, I will definitely make that recommendation. But this is not something that you want to be forced to go and shop for year after year after year when a plan goes away or makes changes that are not beneficial to you. This is something you want to do one time and be done with it, and get with a good company the first time, get good coverage the first time, and just not have to worry about this again. Here's a quick chart from my website at expertmedicare.com. If you look, let me scroll down a little bit to that chart there. It talks about that most of the clients that we work with are on a fixed income. And this chart shows the average Social Security benefit of around $1,200 a month, and then you have a Medicare supplement down here that's just under $200 a month. First of all, most of our clients, we get it for way less than that, so let us shop around if you're paying $200 a month. And this is probably for Plan F as well, which means that there's not going to be any out-of-pocket expenses for any hospitalization or doctor's bills or anything like that. And so if we look at the Medicare Advantage out of pocket, and this is assuming a zero premium, January looks great, no costs. In February, we may have had a trip to the emergency room or had to go to a doctor a couple of times. Our costs are up around $200. But then look in March, that the price jumps up to $1,200. I'm guessing that's probably either an outpatient procedure of some sort or a hospitalization for 2 or 3 nights, along with some doctor's co-payments. And then in April, we drop back down again. May looks great, no cost there. And then in June, something else is going on, and we get back up to $600 for that month. So you can see this jumps up and down. There's no way to predict what could happen. Just like I mentioned earlier, we had the one lady with the chemotherapy that was paying $6,700 a year. I mean, she was way up there. And so that just shows you how these plans work. They're not predictable. With the Medicare supplement plan, you can budget how much it is that it's going to cost, and then you can set it there and not have to worry about it for the rest of the year. This video was very long, and I apologize for that. I don't like making long videos, but there was a lot of information that we had to cover. There's a lot of misinformation out about Medicare Advantage and about Medicare supplement plans. A lot of agents are out there calling Medicare Advantage free Medicare, and it's not free. It could actually end up costing you thousands of dollars every year if there were to be something to happen, some sort of diagnosis, an accident, and things happen. Life happens. Like I said, I'm not about fear. I don't believe in fear. But when something bad like that happens, what happened with this lady I spoke to you about earlier, who has these over $13,000 of co-payments that she's having to pay because of her out-of-pocket maximum. I mean, thankfully she had that and didn't have to pay any more than that. But when something devastating comes along like cancer, the last thing you want to worry about is how you're going to pay the bills. You want insurance that's just going to take care of you and cover you. And the value is there in the Medicare supplement plans. That's why I like them. The coverage is fantastic. You go in, you give your Medicare card and your insurance card, and then you don't have to worry about any of the other stuff. There's a lot to be said about that kind of peace of mind. So my phone number is on the screen. Again, my name is Keith Murray with Integrity Senior Solutions. You can also visit our website. The web address is right there at the top of the description, expertmedicare.com. You can send me an email to Keith, Keith, at expertmedicare.com. Please let me know how we can best serve you. We're here and we're available for you to answer your questions, so give us a call. Thanks.